Hi, my name is Keith Fandry, Doctor of Physical Therapy and Fellowship-trained Spine Specialist Physical Therapist with Back in Action. Today I want to talk with you about spinal decompression and the DRX9000. Every year, millions of Americans are afflicted with severe, debilitating low back pain. Approximately 80% of the population will suffer a significant episode at some point in their life. Surgery is appropriate for a very small number of cases, and in a majority of cases, it's unnecessary to live with low back pain. The DRX9000 can provide significant pain relief for neck and back pain by reducing the pressure within the spine. The intervertebral discs are supplied with nutrients needed for healing using a mechanism called passive diffusion. What that means is that the only way nutrients can enter the intervertebral disc is by altering the pressure within the disc repeatedly over time. The mechanisms I described earlier with spinal decompression help to do this. They help to effectively bring oxygen, fluid, and all the various nutrients into the injured tissue. The same mechanism is why the DRX treats conditions such as degenerative disc disease, degenerative joint disease, and spinal stenosis. So right now we're going to go through a step-by-step process of setting up a patient on the DRX9000. The patient starts in the vertical position, standing in the unit. We're going to begin by lowering the table and getting the patient comfortable lying back. So the DRX9000 is essentially a very advanced, high-tech form of spinal traction. It uses biofeedback and an advanced algorithm to determine how much distraction of the spine is going to be most beneficial to help the patient. A lot of questions kind of come up during patient treatment as they're going through their first treatment, and I want to help answer some of those. Some of the most common questions that arise during treatment are, is the treatment painful? The answer is no. The treatment should be very comfortable. In fact, quite a few patients fall asleep during the treatment and report that it's very relieving for their condition. Some of the other questions that arise is, how long does it take to get relief from my symptoms? Commonly, there is noticeable symptom relief within the first few sessions. Typically within the first 2 to 3 weeks, we see significant improvement in reduction in pain and disability. As the treatment begins, we'll notice a slight distraction of the spine. For safety purposes, over the first several sessions, we'll start with a safe, low amount of distraction that slowly progresses as we go through the treatment protocol. The unit gradually builds pressure throughout a designated time frame, usually somewhere between 30 and 60 seconds, alters the amount of pressure that's applied to the spine for a total treatment time varying between 20 and 30 minutes. So again, spinal decompression with the DRX9000 treats various forms of neck and back pain, including intervertebral disc herniation, spinal stenosis, degenerative joint disease, degenerative disc disease, and generalized low back and neck pain. If you have any of these conditions, remember, there's no need to suffer with daily pain. Schedule your appointment with Back in Action today and get your consultation to see if you're appropriate for this treatment.